it's bold in terms of jerking people around, but I may have gone too far in a few places.
I wanted to make this video to talk about COVID-19, to talk about how severe the problem actually is by taking a look at the data and using Tableau to visualize it again. We got our data again from Kaggle.com. I'm too lazy to go directly to the sources, so I'm not going to go to, Census Bureau or anything like that. So here is the Kaggle data set, and it shows COVID-19 deaths and cases by US county, but also it's divided by US states. They got the data from New York Times, who uploaded it on GitHub. We're going to take a look at this data to dispel some misconceptions that people have. So here we have a heat map, and this heat map is showing you the absolute number of deaths due to COVID-19. We should actually start with this pie chart so we can see something really interesting right off the bat. Almost 50% of the deaths are from just 2 states. Almost 50% of the deaths are from New York and New Jersey. So New York, 26,000 people have died, and in Jersey, 9,000. And this is updated May 7th, so it's pretty recent. I expect they're gonna keep updating it regularly, maybe once a week. So that's pretty cool, actually, and I guess I shouldn't say cool because this is a macabre subject. If you take a look at the heat map again, you can see that a lot of the deaths are in New York, New Jersey, and in surrounding states like Pennsylvania, Massachusetts. So Northeast got hit really hard. The media, when they want to report deaths, they're reporting all of the deaths, which is not useful information because all we would care about right now is where the deaths are trending. So if you report all the deaths since January, that's not helpful, manipulative, because they report the number of deaths without reporting total population. It's like the reason there are so many deaths in New York is because New York has a high population. So it's actually much more helpful to report rates, percentages. So that's what we're going to do. Here's a bubble map. I'm sure they're not called bubble maps, but that's what I'm going to call them. The size of the bubbles represents the number of deaths, and the darkness of the bubble represents the percentage of deaths compared to the total population. So something that stands out, that huge circle over there at New York, that shows you again that about 1/3 of the deaths are in New York. So a lot of deaths are there. But also, that's the darkest circle, which means that the highest percentage of deaths are in New York as well. And that's because New York has a higher population density. So that means the virus worked its way through the state much faster than the rest of the country. So that's why a higher percentage of their population has died. So let's take a look at the worst case scenario. So drum roll, how bad did it get? The answer is surprising. Not very bad. There were 26,000 deaths in New York, which sounds staggering, but millions and millions of people live there. And as a percentage of total population, New York has only lost 1/10 of 1% of their population. That's 0.13%. That's the worst case scenario in the United States. So then the question that you should be asking is that all the deaths? How much longer is this going to continue? Here we can see the total number of cases by day. Yeah, it's cases, not deaths. Let's take a look at New York. So you've heard a lot of people say we need to flatten the curve. Well, if you take a look at this data, it looks like the total number of cases spiked in early April, and they've been declining since. For some reason, there are other spikes here, and I don't know what the spikes are for, but you can see it's clearly trending downward. So this means that New York is already over the hump. They've already, you see all this area under the curve here? They've already had most of the cases that they're going to get. They could be like through 90% of it. And so if you just take a look at the geometry of this curve, it smells like the virus has already worked its way through 80 to 90% of their population. So in New York, they've already gotten past the worst of it. So they've already flattened the curve for the most part. So they should start opening up won't say when, because that's opinion, right? I can't say when. But here's what's interesting. So you've heard a lot of different people say and doctors say we need to flatten the curve. That actually depends on the state, and that depends on the geography. Because if you have high population density near in a city, you definitely do want to flatten the curve, because high population density means the virus is already working its way through rapidly. So you do want to flatten the curve in that case. But that's not true in every area. So that would not be true in rural areas. In those cases, so let's take a look at Montana. Oh, as you can see, wow, Montana's already past it. Probably had a very small population. It's possible they're not past it, but it's a very small sample size. They had a peak of 31 cases one day. Small sample size, so I don't think I'm gonna go with that. So Texas looks different, because with Texas, you can see definitely does not look like we're past the worst of it. And that's because Texas is a huge state. Biggest state in mainland United States, and there are many cities and many rural communities. Cities are spread far apart. So because of a relatively lower population density, the virus has not worked its way through Texas yet. And so I'm gonna say something really controversial, because I've never heard anyone else say this. Depending on the geography of your state, you don't actually want to flatten the curve, you want to fatten the curve. And that depends on where you live. Obviously, if you're in New York City, you want to flatten the curve. But if you're in a rural community, you don't want to flatten it, you want to heighten it. Because we need the virus to propagate quickly enough so that we can finally resume the economy and go back to business, right? If the curve is too flat, and it takes the virus, say, 7 years to work its way through your population, you can't shut off your economy for 7 years. So you either need to reopen the economy now, or you need to fatten the curve and somehow find a way to get the virus to propagate faster through their population. Now, I know I sound insane, but that's not true of every area. It's not true of big cities, it's not true of LA, but that is true in certain areas. In certain areas, the virus is propagating so slowly, you should speed it up so you can get it over with. So with Pennsylvania, you can see they're past the worst of it, but there are a whole bunch of spikes. So the truth is, public policy should vary locally depending on the condition and capacity of the local healthcare system. So the key phrase here would be optimal load. You want to optimally load the local healthcare systems to capacity. If you exceed their capacity, that's a problem, because they won't have enough resources, more people will die, they'll have to triage. But if you don't load them to capacity, then that means that the virus won't work its way through the population as quickly as it could. So in order to reach optimal load, that varies depending on the capacity of the local healthcare system. If you look at deaths by absolute number, that's not informative at all, because higher populations are going to have more deaths. That doesn't actually mean the virus is hitting that area worse. And so that's a problem that I have with the media. They need to stop reporting absolute numbers. Absolute numbers don't tell you anything. So if thousands of people die in China, that's not a big deal if it's China. It's not a big deal relative to the total population. So absolute numbers are not helpful. If you actually take a look at percentages again, you can see New York has gotten hit the hardest. Other states that have gotten hit hard are states near New York, like New Jersey. Two states that have gotten hit surprisingly hard are Michigan and Louisiana. So they've lost 0.04%, and Louisiana has lost 0.05% of their population. I don't know what to make of that. Geographically, it's not clear why. At first I thought, well, maybe it's because they have a lot of shoreline, but Florida, if it was shoreline, Florida would have gotten hit really hard, and they haven't. Florida's gravy. They're doing great. Which also shows you, how the press misrepresent, because there was a story about kids going to spring break and killing people, but actually Florida is just doing gravy, smooth sailing over there. So in conclusion, Nationwide, the number of cases are declining, but they're declining slowly. There are certain states along the Northeast that have already seen most of the cases that they're going to see, like notably New York. So some of them are already past the worst of it. But there are many states along the Midwest, South, West, where we're still going to see a lot of cases trickle in for a long time. Also notable is that the mortality rate is just a fraction of 1%. It's actually very, very low mortality rate.